Hi, Dr. David Schiller here. Today we're going to be talking about the component of fibromyalgia and the fatigue associated with it. If you watched my introductory video on all the different symptoms, we talked about fatigue or chronic fatigue being the same condition but on the other side of the coin. In other words, chronic fatigue syndrome and fibromyalgia syndrome are basically like hand in hand or hand in glove. They go together. Now, the fatigue part of it can be coming from many different things, and there is some things we want to talk about that may not be being addressed in your situation. So, for instance, the fatigue could be from a thyroid condition. It could be from a blood sugar imbalance. It could be from the fact that you do not sleep well. And insomnia is one of the main symptoms. So I'm going to probably talk about these things in the same post here. If you're not sleeping, you're not going to feel well. You're going to be feeling tired all the time. If you're not sleeping, you're not healing. You won't heal up the inflammation that we talked about in the pain post. So just know that if you're fatigued, is it coming from an insomnia problem? Is it coming from a blood sugar problem? Is it coming from a thyroid problem? Thyroid problem, most of the time, up to 90% of the time, low thyroid is coming from an autoimmune condition called Hashimoto's. I have numerous posts on thyroid, so go take a look at them on my channel on YouTube. The fatigue could be due to anemias, and it's not just iron deficiency anemias. It could be B12 anemias. The iron deficiency anemia is because you don't take in iron because you don't have enough hydrochloric acid in your stomach, which we'll go over in the digestive symptom post. So all these things start become intertwined with each other, and if you don't take care of them all at once, you'll never get to the problem. I'm talking about these things individually just because if you have them, you want to learn more about each of these symptoms, but certainly know they all go together. If you do not take care of the way you digest food and extract nutrients, that could create the fatigue. Is it coming from the fact that you don't have enough hydrochloric acid in your stomach, or from the fact that your gut is leaky due to damage from all the inflammation caused by your body's inability to deal with the inflammation, or the brain's inability to squash the pain, producing more inflammation? So again, you start intertwining into this big, nasty web that you have to untangle one by one, and that's how we do it. We look at you as an individual coming into the office, not as a symptom, but as a person who has a problem that we'll take care of by analyzing you on an individual basis. No two treatment plans are the same. Each one is individualized to the person coming in. Is the fatigue coming from a B12 anemia? Is the B12, and are you B12 deficient because you have a thyroid condition, because they're intimately related? Do you have a B12 because you're not taking in enough B12? Are you not producing the factors that allow you to absorb B12 down the line? It's made by the same cells that make the hydrochloric acid, what's called intrinsic factor, but then B12 is absorbed down the line in the intestines. So are you B12 deficient? Either way, if you are B12 anemic or deficient or iron anemic or iron deficient, you will not be able to oxygenate your body. Remember, those anemias cause delivery problems of oxygen to the tissues. So are you fatigued because you're oxygen deficient? Are you oxygen deficient due to stresses in the body, adrenal issues? Are you fatigued because you are adrenally fatigued? Are your adrenal glands not regulating cortisol correctly, which then disturbs sleep and its efficiency? So if you're not sleeping efficiently because of an adrenal problem or cortisol issue, then we know that the blood sugar is out of balance. So fatigue, like that 230 feeling that they talk about on these commercials, that's typically a blood sugar imbalance. You're not balancing your blood sugar effectively. So whether you have high blood sugar or are insulin resistant or pre-diabetic, or whether you have low blood sugar, they are intimately related to how well you produce energy. So again, then that goes back to, well, are you oxygen deficient because of an anemia? Are you oxygen deficient because of a postural distortion? Are you oxygen deficient because you're not exercising or you're smoking? And then you combine that with the fact that you are not getting oxygen or are anemic or have blood sugar imbalances. So oxygen and glucose is what fuels the nerves that are giving you the pain. So everything is intertwined. You have to get to the cause of the problem. So fatigue can be coming from many different places. And again, if you're not sleeping, you're not going to heal. And we've got to get to the cause of that fatigue. So just know the evaluation is key. That's what we do that is unique in that we will look at you with a in fine detail to see what is going on with you. So I hope this information helped. Watch for our next posts and our future posts on this subject, and I hope this helps you make a good decision on how to take care of yourself. So make it a great day.